My name is Robert Sisler. I'm Region 1A Chair for the retirees. And I've been involved in single payer through our local 6,000 since 2005. What happened was there was an immense amount of our retirees who had to endure high copays. And they were suffering. They were actually making choices at that time between eating, paying a bill, or paying for their medications. It's at that point that we got involved with single-payer health care. We educated ourselves about it. Mr. Conyers came down and told us about a bill, H.R. 676, which is based on the single-payer method. Single-payer is very easy to understand. We are an American country. We believe in true democracy, and for years, the wealthiest of this country have lived on trust funds. And a trust fund is simply the family puts the money in, and then it's there when they need it. It's designed to send the kids to college, designed to buy a car, designed to pay the mortgage. That's what you do with a trust fund. You design it. What we are asking is that single payer will act like a trust fund. That all the years that I live, it'll be put into a trust fund. There'll be limits on it. It'll only be for health care and whatever health care needs are. People will not be able to rob it in order to make $1 billion in profit from our health care dollars. It'll be controlled by law, just like trust funds are. And that's what we're asking for. That's what single payer is all about. We have an example of that when we talk about Social Security. Social Security began years ago, and they're talking about it as if it's something unique or a social program. Well, no, it's nothing but a trust fund. My grandparents put into their trust fund when they were making little money. You know, $4 an hour was a high wage. They would take part of that money and stick it into a trust fund so that we could have it. That's our family trust fund. And to now demonize it and say, oh, there's too much money or we got to do something about it is insane. And the people of this country who've worked hard and put it in should be demanding that their trust fund, by law, not be touched.